Case 3, AD, 12 years old, from an intelligent family. Father, Jewish. Mother, Russian. Heredity. Father, a musician, reserved, prone to doubt, extremely shy, sociable only within a small, intimate circle, lacking in distinguishing characteristics, highly suggestible, poorly adapted to life, frequent stuttering. Grandfather on father's side died of cancer. Grandmother reserved, domineering, difficult to get along with, suspicious, stingy. Uncle enthusiastic, boastful, an adventurer. Mother healthy. Grandfather on mother's side died of progressive paralysis. Uncle withdrawn, surly, eccentric, and pathologically stingy. Another uncle, a gifted musician and mathematician, was erratic, his behavior alternating between the excitable and the lethargic. The boy is the first and only child in the family. Physical development is normal. Grew up as a healthy, intelligent child. Learned to read at the age of 5. Had a good memory. As early as age 5, his parents noticed that he was a peculiar child. What stood out were his absent-mindedness, his rapid shifting from one subject to another, and his sometimes motiveless actions, such as suddenly throwing objects out the window. Would periodically become enthusiastic about something and devote himself exclusively to it. At the age of 6, he suddenly began devising long arithmetic calculations, then gave them up after 3 months. At 7, he started composing short songs. He started school at the age of 10, where he played the role of a joker and was the object of general mockery among his classmates, even though he learned better than the others. By the age of 11, obsessive themes had become apparent in his conversation. He holds forth, pesters everyone, and gives everyone nicknames. In 1923, he was placed in our clinic's therapeutic school. The mother, who provided information about the boy, emphasizes that no deterioration in his behavior has been observed from childhood to the present. Rather, the boy is improving and beginning to show a greater interest in practical life. Status. In terms of body length, body weight, and chest and head circumference, he is 2 years ahead of his age. Asthenic body type. The ratio of the limbs to body length is greater than normal, approaching the unicoid type. Long, slender neck, thin limbs, drooping shoulders, flat chest. Musculature and subcutaneous adipose tissue poorly developed. Smooth, elastic skin. Scalp hair coarse, dense, wavy, with patches of gray hair. Terminal hair absent. Good hearing and sight. Even pupils. Lively reaction. Idiomuscular excitability slightly increased. White dermographism. Excessive, restless movements, many of them superfluous. Retardation according to the Dr. Ozoretsky scale, 2.8 years. Awkward angular gait. Slack facial expression. Laboratory examinations. Wassermann reaction negative. Examination of the autonomic nervous system revealed instability of both systems and a paradoxical reaction to pilocarpine. The blood count shows no deviation from the norm. Psychic state. Demonstrates a vast store of knowledge and strong mathematical skills during the examination. In terms of general level, he is ahead of his age. According to Binet, he corresponds to 15 years. Good, but uneven memory. Good ability to retain numbers and words, though prone to confusing people. Rapid associations, no blocking. Many external associations. Sometimes automatism, a tendency to get stuck on one and the same topic. No scattered thinking. The logical processes proceed in an orderly manner. Identifies similarities and differences well and draws correct conclusions. There is a tendency toward compulsive rumination. Why are there so few children at the school? Why is the number of girls lower? And so on. He pesters people endlessly with these questions until he receives an exhaustive answer. Extremely talkative, yet at the same time reserved and reticent. He is reluctant to speak about his experiences. If the conversation turns to him personally, he passes over it in silence or brings up a new topic. At school, he plays the role of a joker, behaves foolishly, and comes up with various nicknames for the children. However, he does not take part in any shared games. Highly suggestible, mimics everyone. The mood is always somewhat elevated. His emotional life is flattened. His behavior towards everything appears superficial. Nothing touches him deeply, neither sorrow nor joy, and everything passes very quickly. Crude, selfish impulses are absent. He is neither greedy nor malicious. He is devoted to his parents. A great dreamer. He lives in a world of his own imagination and often forgets reality. Compulsive states and compulsive counting were observed. It occurs to him, for example, to count the members of the audience present in the theater. He devises methods especially suited to this purpose, counts the audience members after the door has closed, and, during the intermission, hurries to add in those who arrived late, tallying them off on his fingers. Phobias also occurred. He had a fear of flies. In class, he finds it difficult to focus his attention on his work. The capacity for purposeful effort is lacking. He either automatically falls in line with the others or quite unwittingly disrupts instruction by asking questions that are irrelevant to the matter at hand. Possesses musical abilities and a good musical ear. Things are going poorly, however, with gymnastics, rhythmic exercises, and manual work. No significant changes have occurred in the last 2 years. In 1924, he entered a music academy, where he made good progress. Summary. The following features can be cited as characteristic of this case: a somewhat elevated, silly mood, a tendency towards stereotypies and absurd ruminations, heightened suggestibility, automatism, compulsive calculating, phobias, and a certain shallowness of emotion. According to the examination in the psychological laboratory, his intellect is above normal. Somatic characteristics: asthenic body type, unicoid features, tall stature, marked motor impairment. Course: stable, no drastic fluctuations. Diagnosis: psychopathic personality, eccentric.